if this is a part of your journey, or if you are someone who has removed gluten from your life and you feel substantially better, it's not a guarantee that it's celiac. There is, like I said, there is such a thing as just gluten intolerance. And the only way to assess if it's celiac or not is to do the blood work and do a scope. And you have to put gluten back in your diet to do that. I would recommend about 3 months of having a small daily gluten exposure. Yeah, we're damaging your small intestine to do that if it is celiac. But the good news is it fixes itself. Like, the body is such a beautiful thing. And that was something my husband really had a hard time wrapping his head around, is like, well, is it going to grow back? Like, how do we fix it? And I was like, yeah, the cool thing is like, once the immune system is done doing its damage, your small intestine just regrows its villi. Like, how cool is that? That's so fascinating. So if that's the case for you, I know, especially if you get symptoms from eating gluten, sometimes adults choose to just live a celiac life because they assume they have it and they don't want to do the testing. And I get that. I get that from a symptom perspective. I would argue, if we are in a fertility experience, that having the proper diagnosis actually helps us. Because if it's gluten intolerance, okay, don't eat the gluten because it's probably causing inflammation and obviously your other symptoms, and we don't like that. But if it's celiac, that's an autoimmune condition. Now we have to really actually figure out, how much do we have to manage the immune system in your fertility journey? I have some clients that need to use steroids to get pregnant when they have multiple autoimmune conditions or even one autoimmune condition. And I have others that don't, right? There's a spectrum. There's a wide variety of how is this going to impact me? I'm not sure until we know. So having that diagnosis, I think, is important. So yes, you have to put the gluten back in. Does that seem counterintuitive? Absolutely, it does. However, does it unlock some potential treatment options and doors from a fertility angle? Does it help us make fertility decisions? Does it open up the door of like IVF with immune treatment? Makes sense? Perhaps. So it's something definitely to consider. And I don't want to scare anyone by being like, my daughter didn't really have classical symptoms, and like, here we are. But that's the reality, right? So to summarize from the beginning, in terms of, so none of you feel like you have to run to the lab and screen yourselves for celiac, based on our data, I really don't think we need to necessarily be screening everybody. But if you have unexplained infertility, I think it might be worthwhile, honestly, at this point, to be throwing it into lab works. It's something we're probably going to start having a conversation about in FCM with our clients. Like, let's just do it. We do remove gluten in our accelerator process for 3 weeks. And so judging by how you feel with that might be another sign of like, hey, let's put it back in and do the testing, just to see if you notice big changes with that. You never know.